please.
Rich Leon.
As a statement, not a question.
Rich Leon.
He's like, shit, I'm back in this class. Welcome back. Okay, introduce yourself.
Rich Leon.
Much better. There we go.
Thank you. Okay. 4 years ago, returning to my hotel from doing field research at a small village in Nigeria, our car blew a tire and flipped 3 times. I suffered a deep laceration to my left arm, and it required a transfusion. The hospital I was taken to didn't have the means to test me properly. The transfusion blood was infected with HIV.
How soon after were you diagnosed HIV positive?
4 months later. And last year I developed full-blown AIDS.
Do you think this has affected how you treat patients?
Since developing the disease, I believe I have more compassion than I did before.
What about your attitude towards the work in general?
I feel even a greater sense of dedication.
Are you a fanatic doctor?
Of course not.
How do you explain Natalie Miller's death?
Natalie's health was deteriorating very quickly. I felt that additional drugs would boost her immune system.
Were you aware of
Did you care about this little girl?
Deeply.
Good. Additional drugs were her only chance. Defend yourself. Go.
Natalie's health was deteriorating very quickly. I felt the additional drugs would boost her immune system.
Were
Good.
you aware of any risk?
I knew there would be substantial risks in giving her 7 medicines, all known to have adverse side effects. But I was only concerned with the here and now of her health and the possibility of her survival.
Do you regret your course of action?
I don't at all. This wasn't about the experimentation for the benefits of others. I was trying to save a little girl's life. Fortunately, I failed.
Doctor,
Eyes up.
Doctor, are there any other doctors or nurses in the Children's Healing House AIDS ward diagnosed with HIV or AIDS?
There is one floor nurse and an orderly. I believe that's all.
You aren't open about it?
Yes.
Why weren't you?
I felt it was a private matter. I still do.
Is there any prejudice in the medical community against doctors with HIV or AIDS?
There has been in the past.
Have you seen prejudice or ill treatment of the nurse and orderly on your ward?
No.
Isn't it true you kept your HIV and the AIDS status secret to avoid accusation that you are an opportunist?
That's absurd.
Isn't it true you used the children in your program as guinea pigs to test dangerous treatments in the hope they would be beneficial to you?
I treated them aggressively but selflessly.
People 61, Your Honor. Do you recognize this, Doctor?
CD4 plus count. It's a test that measured Natalie Miller's T-cell count.
She measured 212. What does that number indicate?
She was in danger of getting AIDS.
People 70, Doctor.
Another CD4 plus count of Natalie's weights from 6 months later. She was up to 416.
Close to normal, right?
500 is normal. Yes.
People's 85 and 89, Your Honor. What's this, Doctor?
There's CD4 plus counts of mine.
On the first test, you scored 208. On the second, 420, correct?
That's correct.
Would you note the date on those tests in relation to the ones for Natalie Miller?
I don't know what you're trying to prove here.
You have the same T-cell count as Natalie Miller, only staggered back 6 months. That suggests your virus was mimicking hers.
I see a coincidence.
There are 16 studies for
Eyes up.
blood counts in evidence for both you and Natalie Miller. If she has scored 316, 6 months later, so would you? If she scored for 26 months later, so would you? Your mutation pattern was a mirror of hers, wasn't it?
I have no idea.
But you do know. You didn't want them to know this, right? Keep going.
Then why
Is
is
that-
it every time Natalie White's CD4 count showed a viral load flare the next morning, you would be on a plane to Costa Rica for treatment?
How many people have you watched wither away and die, Mr. McCoy?
Take a pause. Just because you have the same disease and it's mimicking hers and you're trying to save your own life does not mean you weren't trying to give her the best care possible. She's accusing you of killing this little girl just to save your own skin. And you can take offense to that. Shut this bullshit down. Go.
How many people have you watched wither away and die, Mr. McCoy?
You didn't want to suffer her fate, so you pushed her dosage until they were fatal. Isn't that true, doctor?
If she had survived, we could have saved 80,000 children a year.
But you didn't. So she was salvaged. Is that correct?
I did what I thought was right, to save innocent people from wasting hell.
And yourself too.
Stay with her. Dun, dun, dun. Commercial break. Right?
Be right back.